When we're doing our specific back rehab exercises, such as the dead bug, which we'll use an example for in a moment, when we experience pain, this should lead us to ask a number of questions, but we want to explore precisely at what point did we experience the pain. We have to evaluate this within the context of our daily pain. If we got into the position ready to do the exercise and we did not have aggravation of our sciatic symptoms or sciatic pain at that moment, because what's happening when we experience pain in, for example, the dead bug, is that as we are lying on our back, assuming we didn't aggravate our back getting onto the floor, in which case we should be doing this variation on the bed, as we lie down on our back like so, often most people can get a degree of core engagement in this position, and as they bring the first leg up, they're kind of okay because they've still got one leg based, but as the second leg comes up, like so, into what's called a tabletop position, the back arches one way or it flattens the other, and boom, we get that pain. What happened here? We didn't control the spine. The spine moved. It moved this section down here where that sciatic nerve root is being irritated, and we experienced an immediate boom, a little bit of aggravation. The severity here is not important. The fact that we've got some aggravation is what is important. Another option could be that as we were in this position, we've done that fine. We've learned how to engage our core. But as the one leg went out, we got past maybe close to the halfway point, maybe a little bit less, maybe a little bit more. And all of a sudden we got some pain. What was happening here? Our back was starting to arch as our core was failing to meet the desired level of contraction to deal with that load of the leg going out. In both of these circumstances, the pain was there as an indicator that we failed to do the exercise correctly, which leads us to two questions. The first being, did I just not quite engage myself correctly and not quite do the exercise the way in which I'm supposed to do? The second question is, well, I've tried a couple of times, but I'm not stopping it happening. Do I need to do an easier variation? Because maybe I'm just not strong enough to deal with this kind of load right now. In the first scenario, we're looking at maybe revisiting our technique, maybe going back and watching some of the tutorial videos. Maybe you didn't quite have that core engagement correctly. Maybe you need to use a small towel to help you feel what the back is doing. Those sorts of modifications can help you try again and see if we can do it without experiencing the pain. A tighter core engagement is often one of the fixes for this, a greater awareness. In the second scenario, it very reasonably is that we are actually just working at a level that's too difficult. And so we need to go back and look at some of the tutorial videos, for example, and we have many within the program and also on YouTube, to find an easier version. Maybe in the case of that half rep that we discussed, as the leg was going out, well, there was a point at which it became too much. And often, as you try this a couple of times, you'll find it's the same sort of point. It's about halfway. So we come back off there. That's the important thing that we're using with that pain, to look for the aggravation-free reps. And it's worth just noting it. For some of you, you have that sciatic pain kind of all the time. And so it's at a baseline. It's always at a 3, for example, out of 10. And so when we're doing these exercises, we're looking not for no pain, because that wouldn't work for some of you who do have that constant level of pain, but we're looking for no aggravation of the symptoms in the moment.